Continues to battle the challenges posed by sickle cell disease, ranging from pain management to care and access to adequate treatment. There is a rising need for public knowledge and an understanding of sickle cell disease. In commemoration of World Sickle Cell Day 2025, the Rivers State Teaching Hospital has revealed that it has treated over 200 children living with sickle cell disease in the past year, utilizing advanced medical technology. Correspondent Doris Morrison gives the report.
The Chief Medical Director of Rivers State University Teaching Hospital, Professor Chizindu Aleko, made this known at this year's World Sickle Day celebration with the theme Transforming Care and Strengthening Communities. Professor Aleko emphasized that pain management remains a critical aspect of care for individuals living with the disease, stating that the time is now to prioritize discussions around it and sickle cell treatment. He added that RSUTH is committed to providing care for sickle cell patients under his watch, stressing that financial constraints should not hinder access to treatment, unveiling a free treatment plan for children living with sickle cell disease.
We've made a commitment that all our sickle cell disease patients must have speedy care on a fast-track pathway. Also made a commitment that on no account should such a patient come in and on ground of finance, care is denied. They must have full care, and finance shouldn't stop the care.
In her remarks, the keynote speaker, Dr. Folunke Fashola, who spoke on pain management and sickle cell disease, said 7.7 million people were affected with the disease across the world in 2021. 2 to 3% are Nigerians. Meanwhile, a consultant pediatrician, Dr. Chioma Okechukwu, has identified stroke as the most devastating complications of sickle cell disease. Dr. Okechukwu explained that stroke prevention is a simple non-invasive procedure in which an ultrasound probe is used to examine the patient's brain for a potential stroke risk.
Swung into action immediately to begin this diagnostic investigation in our facility. And so we do it for children aged 2 to 16 years, and we do it once a year. And based on the American Society of Hematology standards, once you do this scan once a year and you don't detect a risk for stroke, it's possible to categorically say that that child does not have any risk and will not come down with a stroke in 1 year. And so we do this procedure for our children now every year. Initially,
a mother of 3 children living with sickle cell disease and a young adult who is a carrier spoke about their experiences in tackling the disease.
I just want to advise parents to hold on there, and they should just obey whatever the doctors tell them to do. They should not go to all these herbal doctors, herbalists, to all these herbal drugs. That this one can cure sickle cell, this one can cure sickle cell. They should close their ears from that.
The experience as a sickle cell warrior has been both challenging, but with God, my caregivers, my doctors, the kind gestures and all of it keeps making me stronger, keeps giving me that hope that I can still live like every other person that are not with the disease. I can still achieve my dreams. With the encouragement and all of that, I'm still grateful, I'm still strong.
The World Sickle Cell Day is observed annually with a goal to increase public knowledge and an understanding of sickle cell disease and the challenges experienced by patients, their families, and caregivers. Doris Morrison, ADBN News.